Did you know that every 65 seconds, another senior gets a dementia diagnosis? But here's the shocking truth. The real cause might not be aging. It could be hiding in your medicine cabinet right now. New research shows that 99% of seniors don't know that at least one pill they take daily could shrink their brain's memory areas by over 28% in less than a year. The drug companies have known this for decades, but keep making billions while millions of seniors lose their memories. Before we start, hit that like button if you or someone you love takes multiple medications daily. Subscribe for more life-saving health tips and share this with any senior who needs this information. Tell me in the comments what medications you're taking and if you've noticed memory problems or brain fog. I read every comment and want to help protect your brain health. Number 9. Diphenhydramine, the sleep pill that steals. Memory diphenhydramine, known as Benadryl, sits in almost every senior's medicine cabinet. It's that pink pill you trust for allergies, sleep, or cold symptoms. It's cheap and seems completely safe. But inside your brain, this innocent-looking pill is quietly attacking your hippocampus, the part that makes and stores memories. Benadryl belongs to drugs called anticholinergics that block acetylcholine, a brain chemical you need for memory and staying alert. As you get older, your brain makes less acetylcholine naturally, so every bit becomes precious for keeping your mind sharp. When Benadryl blocks this chemical, the damage can be terrible. A 2023 study found that seniors who used anticholinergic drugs like Benadryl regularly had a 54% higher chance of getting dementia. That's more than half again the normal risk of losing your memories. The worst part is how Benadryl hides in other products. Any medicine labeled PM, nighttime, or allergy relief often contains this brain-damaging ingredient. Many seniors take several products with Benadryl without knowing it, making the brain damage even worse. The good news is, safer options exist. For allergies, try Claritin, which doesn't affect your brain. For sleep, melatonin or better sleep habits work without hurting your memory. Number 8. Proton pump inhibitors, the acid blockers. That block your brain proton pump inhibitors like Prilosec and Nexium are very common pills for heartburn and acid reflux. These drugs work by stopping your stomach from making acid, which gives quick relief from burning feelings. Many seniors stay on these pills for years because symptoms come back when they stop. But here's the problem. These acid-blocking drugs stop your body from absorbing vitamin B12, which your brain needs to work properly. Your stomach needs acid to pull vitamin B12 from food, along with other important nutrients like magnesium and calcium that help brain cells talk to each other. When these drugs block too much acid for too long, your brain doesn't get the fuel it needs. A huge 2016 study of over 73,000 seniors found that regular users of these drugs had a 44% higher risk of getting dementia. These medications also increase toxic proteins called amyloid plaques in the brain, which damage brain cells and cause Alzheimer's disease. When your brain lacks nutrients and has these harmful proteins, brain cells can't work right, causing confusion and memory loss that looks like Alzheimer's. If you take these drugs daily, ask your doctor about switching to safer options like Pepcid, which is less likely to hurt your brain and still helps with acid problems. Number 7. Bladder control medications. The bathroom fix that breaks your brain. Oxybutynin, sold as Ditropan, is often given to seniors with bladder control problems. Nobody wants to deal with embarrassing bathroom accidents, so this pill seems like a perfect solution. But this drug works by blocking acetylcholine, the same brain chemical that Benadryl blocks. The scary part is that oxybutynin gets into brain tissue more easily, and attacks memory areas directly. A 2019 study found that seniors over 65 who took strong bladder drugs like oxybutynin for more than 1 year had a 49% higher risk of getting dementia. That's almost 1 in 2 people. What makes this worse is that doctors rarely warn patients about memory problems when prescribing these pills. They only talk about fixing bladder control, not about destroying brain function. Patients often describe feeling foggy, forgetting appointments, losing things, or having trouble following conversations. These symptoms get blamed on normal aging when they're really caused by the medication. The good news is newer bladder drugs like Myrbetriq work differently and don't block the brain chemicals needed for memory. If you're taking oxybutynin and having memory problems, ask your doctor about these safer options that control your bladder without damaging your brain. Number 6. Statins. When cholesterol pills starve your brain, statins like Zocor and Lipitor are among the most prescribed drugs worldwide, especially for people over 60. They lower cholesterol to prevent heart attacks and strokes, which sounds great for your health. But here's what nobody tells you. Cholesterol isn't just important for your heart. Your brain absolutely needs it to work properly. Your brain is almost 60% fat, and cholesterol helps build the protective coating around nerves that keeps brain signals moving smoothly. When statin drugs aggressively lower cholesterol, they might be starving your brain of what it needs to function. A 2023 study found that seniors over 70 who took statins for more than 3 years had a 26% higher risk of memory problems. Some patients reported sudden memory loss where they couldn't remember names, recent conversations, or familiar driving routes. Not all statins affect the brain the same way. Some, like pravastatin and rosuvastatin, don't get into brain tissue as easily and are considered safer for memory. If you've been on a statin for years and notice brain fog, forgetfulness, or confusion, talk with your doctor about lowering the dose or switching to a brain-safer option. Don't wait until the memory problems become permanent. Number 5. Benzodiazepines, the anxiety pills that trap. Your mind benzodiazepines like Ativan, Valium, and Xanax are widely prescribed for anxiety and sleep problems in seniors. These drugs work by boosting GABA, the brain's calming chemical that reduces stress and helps you relax. At first, they seem like miracle pills that quiet anxiety and help with sleep. But over time, these medications become a dangerous trap that's hard to escape. These sedating drugs don't just calm anxiety. They slow down your entire brain, including parts responsible for memory and learning. A 2022 study of over 8,000 seniors found that those who used benzodiazepines for more than 3 months had a 51% higher risk of getting Alzheimer's disease. Long-acting ones, like Valium, stay in your body longer and build up in brain tissue, making the risk even higher. Seniors on these drugs often feel disconnected and foggy, like they're viewing life through thick glass. They struggle with conversations, forget important events quickly, and feel like they've lost their real personality. The worst part is when they try to stop. Withdrawal symptoms like severe anxiety and insomnia can be worse than the original. Problems. If you've been on these drugs for weeks or months, never stop suddenly. Work with a doctor to taper off slowly and consider safer alternatives like buspirone or therapy. Number 4. Amitriptyline, the multi-purpose memory. Destroyer amitriptyline, known as Elavil, is an older antidepressant that's still commonly prescribed today for pain, sleep problems, and even migraines. It seems like a perfect solution since it can help multiple problems at once. But this drug is one of the strongest anticholinergic medications still used, meaning it blocks acetylcholine so powerfully that memory problems aren't just possible. They're almost guaranteed with long-term use. A massive 2015 study of over 3,400 seniors found that those taking high doses of anticholinergic drugs, like amitriptyline over 10 years, had a 54% higher chance of getting dementia. The damage happens slowly and silently. Patients notice subtle changes like trouble finding words, forgetting recent events, or persistent mental fog. These symptoms often get blamed on aging or depression rather than the medication causing them. Many patients taking amitriptyline were never told about the memory risks when it was prescribed. They were told it would help with pain or sleep, with no mention that it could slowly destroy their mental sharpness. If you're taking amitriptyline and notice memory changes, talk to your doctor about alternatives. For nerve pain, duloxetine or gabapentin may help with less brain risk. For sleep, melatonin or low-dose doxepin are safer options. For mood, newer antidepressants like sertraline are much better for brain health. Number 3. Paroxetine, the dangerous SSRI. Exception paroxetine, sold as Paxil, is a common antidepressant that belongs to the SSRI class. Most SSRIs are considered safe and don't hurt memory much, making them popular for treating depression in seniors. But paroxetine is the dangerous exception. Unlike other SSRIs like Zoloft, paroxetine has strong anticholinergic effects that interfere with brain chemicals needed for memory. A 2021 study found that seniors taking paroxetine showed measurable drops in short-term memory, word recall, and attention within just 12 months. They were also 30% more likely to show early signs of memory problems compared to those on other antidepressants. The sad irony is that paroxetine is prescribed to stabilize mood, but over time it actually hurts the mental clarity it's supposed to help. The American Geriatric Society has put paroxetine on its list of drugs that are potentially dangerous for older adults. If you're taking paroxetine, work with your doctor to switch to safer SSRIs like sertraline or escitalopram, which help depression just as well without the memory risks. The change should be done slowly to avoid withdrawal symptoms. Adding B vitamins, especially B12 and B6, can also help support your mood naturally. Number 2. Antipsychotics. The psychiatric drugs given for minor problems, antipsychotic drugs like Seroquel, Risperdal, and Zyprexa, were made to treat serious mental illnesses like schizophrenia. But today, these powerful brain-altering drugs are often given to seniors for minor problems like sleep troubles, mild confusion, or being restless. Many seniors don't even know they're taking psychiatric medication. They just know they got a pill to help them sleep or calm down. A 2022 study of over 25,000 older adults found that seniors given antipsychotics for behavior problems were 71% more likely to have worsening memory loss within 12 months. These drugs also increase the risk of stroke, sudden death, and dangerous falls. They work by blocking dopamine, a brain chemical needed not just for mood, but also for memory and thinking clearly. When dopamine levels crash, the brain becomes slow and unresponsive. Seniors on these drugs often appear flat and emotionless, and family members watch their loved one's personality disappear. The tragedy is that many behavior problems can be managed without drugs, through better daily routines, reducing noise, addressing pain, and improving sleep habits. If a loved one is on these medications, ask the doctor if they're really necessary and what non-drug options might work instead. Number 1. Multiple brain-blocking drugs. The hidden epidemic, the most dangerous threat to senior brain health, isn't one single drug. It's taking multiple medications that all block brain chemicals at the same time. This is called anticholinergic polypharmacy, and it's the hidden epidemic that almost no doctor talks about. Picture this. A senior takes Benadryl for sleep, oxybutynin for bladder control, and amitriptyline for pain. Each drug alone might cause mild memory problems, but together they create a brain disaster. When multiple anticholinergic drugs are combined, their brain-blocking effects don't just add up, they multiply. A 2022 study of over 280,000 older adults found that those with the highest anticholinergic burden had a 120% increased risk of dementia within 10 years. That's more than double the normal risk of losing your memories. Most seniors have no idea. They're taking multiple brain-blocking drugs. Different doctors prescribe medications without knowing what other specialists have prescribed. When acetylcholine is blocked from multiple directions, the brain doesn't just slow down, it starts to break down. Brain cells become weak, connections disappear, and the whole brain enters a state that looks just like Alzheimer's disease. The amazing news is that much of this damage can be reversed. Unlike real Alzheimer's, drug-caused memory loss often gets better when the harmful medications are safely stopped. Ask your doctor to review all your medications for anticholinergic effects. Online tools can calculate your total brain burden. Many seniors who reduce these medications report dramatic improvements in memory and thinking within weeks or months. Your brain can heal when given the chance. Your action plan for brain protection. The medications we've discussed are serious threats, but you have the power to protect your brain. Become an active partner in your healthcare instead of just accepting every prescription. Schedule regular medication reviews, especially if you take multiple drugs or notice memory changes. Ask your doctor specific questions about brain side effects, especially if you're over 65. Find out if safer alternatives exist and whether any of your medications block brain chemicals. Don't hesitate to get second opinions or see geriatric specialists who know about age-appropriate prescribing. Remember that many conditions have safer treatment options. Sleep problems often improve with better sleep habits and melatonin instead of Benadryl. Anxiety responds well to therapy and exercise rather than benzodiazepines. Pain might be better managed with physical therapy and safer medications. Thank you for watching this important information about medications that can hurt senior brain health. If this video opened your eyes to hidden risks in your medicine cabinet, please hit that like button and subscribe for more life-saving health content. Share this video with any senior who takes multiple medications. This information could save their memory. Tell me in the comments about your experiences with these medications or questions about safer options. Protecting your brain health is one of the most important things you can do for your future.